And as soon as this hits, there we go. And we are live.
Sweet.
As opposed to undead, which would be bad. Anyways, it's the Booze and BJJ podcast. Wole and I are here late Sunday night. Gonna review some interesting things, I suppose you could say.
Yeah.
Um, Dude, I heard you had a concussion.
Yeah. Some time ago. Judo took a bad fall, hit my head on back of my head on the mat. So I was up for probably about 6 weeks. Well, I was fine after maybe probably after like 3 or 4 weeks, but just extra cautious and yeah, it's not fun. Do not recommend 0 stars.
Dude, there's a judoka at our gym, guy by the name
hmm
of Anthony, one of Jordan's friends. I actually
hmm
learned judo from Jordan's dad. He disappeared for a little while and then came back, and come to find out he got a concussion too. So I thought
Oh
it
yeah.
was because of competition or something,
hmm
training accident. Nope, it had nothing to do with training at all. He was building a shelf
Oh,
and
and
it
it fell on his head.
fell on his head.
Oh, that sucks.
Yeah.
Did you say you learned judo from Jordan's dad, or the guy learned judo from Jordan's dad?
Oh no, this guy learned judo from Jordan's dad.
Okay.
Yeah, so Jordan's known him since he was this
Yeah.
guy Anthony was itty bitty. So that's it's an interesting little connection there. But yeah, he's been training at our gym, but I think he must
Well,
have hurt himself again because he disappeared again.
yeah, injuries are no fun. It's, yeah, it's
Yeah.
just no.
So you started training again? I take it.
Yeah. I mean, I've been back for about I want to say about like close to a month now. Um, but life's kind of getting in the way, so I need to figure out my schedule and figure out my training schedule, all of that stuff. Because I think I want to do a couple of competitions towards the end of the year. And when's Pans usually? Is it April?
I think it's April.
Okay.
You have plenty
Yeah,
of time.
I may do that. Pans. So,
No good. Um, so ADCC
hmm
is in September,
yeah.
and somebody we both know has entered. He signed up.
Yeah.
Yeah. I'm not gonna reveal who yet because I don't think he's told very many people. But
Are you talking in third person?
I am not doing my. I am way too old to do ADC. No, that's not true. Um, I don't have enough time to train to do it.
Yeah.
Yeah.
The ADCC, the rules are different.
Yeah.
It's like a lot more, like a lot, they allow a lot more than a usual tournament.
So I got a legal technique list. I can't
Mm,
pull it up because somebody texted it to me, but check this out. So for adult beginners,
hmm
where'd it go?
It's all no-gi also, right?
Right.
What?
So for adult beginners, here we go. Knee bars, knee reaping, wrist locking, groin
Oh,
stretching, toe holds, heel hooks, spinal stretch,
oh.
kidney crush.
What's
What the hell is
that?
that? Um, Bicep and calf slicers are
Wait, so what is not,
legal.
so if this is beginners, then what's like intermediary and advanced?
So check this out. Oh, do have masters, which is 35 and up. Beginners, intermediate, and advanced. The only illegal technique, there's two: jumping guard and slamming is not allowed.
Hmm.
Everything else is fair game.
So you could do like flying arm bars and all that stuff, I guess.
Yes, yeah.
Yeah, that's not for me. That's not for me. I'm good.
For adults, advanced,
Mm,
you can do everything, including slamming.
yeah.
I I like my spine. Um,
So I guess the only illegal thing across the board is jumping guard.
uh, no, the only thing even remotely close to being illegal across the board is slamming. The only category where it's legal is adults advanced.
Mm.
Jumping guard is legal from adults beginner to advanced. For masters, it's illegal. In all the juvenile and kids categories, it's illegal.
Mm.
It's crazy.
Yeah, I'm good. No
I
need.
think, yeah, I think I'm good.
Yeah,
No. If it was just heel hooks, I think I could probably hang.
yeah,
I've gotten pretty good at getting out of them. Applying them, not so great. Toe
yeah,
holds, I'm decent with. Um, I need
yeah.
to. We
I
need
need
to.
to train that stuff because I need to recognize when I'm getting heel hooked or like toe holded,
Toe held.
toe holded.
Well, on September 1, we're having
Hmm.
a special guest for my no gi class, and we're
Yeah.
that's basically what we're going to cover. So,
What time?
7. So that class usually starts at 7, but we've been starting at 7:15 to give Frankie and his guys a little extra time. You can come
Mm,
late if you want.
yeah. Number one. How to get out of heel hooks.
I want to know what a kidney crush is.
Yeah, that's what I was looking up.
Here's another interesting one: a muffler.
The names of these. I feel like a muffler is when you just put your crotch in the person's face or something.
I think it's maybe when you just cover their mouth.
Yeah, probably. Which
Um,
is super annoying, but yeah.
so so let's actually go over this, and then we'll get into the
Yeah, yeah.
other stuff. So they have the techniques broken down into different categories on here. So the first category is Americana armbar. It just says chokes.
Mhm.
Guillotine, omoplata, kimura, Ezekiel, buggy chokes. The buggy choke made the list. And pulling head triangle.
Mm.
So that's the first category. Second category is simply just muffler.
It gets its own category.
Yeah. The next category is shoulder lock variations. Okay. And it says Barato plata and Tarico plata. But it does not have the Tamo plata.
Wait, Barada Plata and what?
Tarico plata? Yo does the Tarico plata, I think, quite a bit. Hey, Mango, how's it going? So, oh, then it goes on to straight ankle.
Hmm.
Then the next category is knee bar, knee reaping, wrist lock, groin stretch, toe hold, heel hook, spine stretch, kidney crush. Did you look that up? Do we know what that is?
Yeah, I can't seem to really find anything about it. Kidney crush.
And then bicep calf slicers, bicep slash calf slicers.
So I look kidney crush. It looks like there's a thing called a scorpion rib crush. Seems to be what comes up.
Dude, is it a scorpion deathlock from like WWF?
I don't know.
Hmm.
Let me see.
So, Mango, we're talking about the ADCC legal technique rules and the different age categories that allow what. So that's because we know somebody who's um, entered the ADCC and is going to compete soon. So we're just going over to see what he's going to be walking himself into. Leg scissors, dude. Why do they have leg scissors and then no arm triangle in the in the same category? That seems a little weird.
Yeah.
Clavicle spine lock, cranks, and face locks. Yeah. Where'd you go?
Hold on.
Okay. So check this out. Each coach will be given a red or blue beanbag to have the ability to end the match at any moment. Once the beanbag has been thrown, the match is final and the opponent will win the match via submission. Please note, referees have the ability to call a match for any submission that they may cause serious harm to a kid or teen. Oh, that's for the juvenile brackets. Okay. That's crazy. Well, anyways, the fact that they're allowing knee reaping, heel hooks, and all that other stuff in the beginners bracket for adults, that's a different type of game right there. So, yeah, our mutual friend who will not be named yet he's got a learning curve that he's gonna have to get used to because this is gonna be no joke. I can see why people consider this to be like one of the premier or top competitions that you could enter. So we give Wole a little bit and give Wole about a minute to come back, and then we'll start on the video review that we're going to do. So for those of you who follow our YouTube channel, I did a review about a teenager, a rather big teenager. Like, calling this kid a teenager, even calling him a kid, is not an accurate description. But he has been entering jiu-jitsu competitions as a blue or purple belt. I think he started doing this at blue belt, but he's now a purple belt. He's been fighting adult black belts and winning. But the thing is, how he's winning is the controversial part. So, you good, Wale?
Yeah.
The crazy thing is, when you read the caption of a 15-year-old beating an adult, or even a 16-year-old beating an adult, because he's 16 now. We are going to review one of his matches when he was 15, but when you have that in your mind, you envision like a, smaller adult male, not necessarily already filled out, still has room to grow physically, defeating somebody probably bigger, taller, obviously much more mature. That's not necessarily how this is going to play out. This kid is big. He's definitely, by looking at him, he's definitely larger than me. I'm 5'8", 200 pounds. So,
He's larger than me too.
Say again?
He's larger than me too.
Yeah,
So,
and Wale is, how tall are you? Like 6'1"?
6 feet.
Oh, you're 6 feet? Yeah.
6 feet, 215. So,
Yeah, he's bigger than both of us. But anyways, so what we're going to do, we're going to review one of his matches when he was 15. 15-year-old blue. I don't even think he was a blue belt at that point. We're going to review that match, and then we're going to review a video from a doctor who explains the potential injury, some of the stuff that he can cause, his opponent. So let's begin, shall we? Let's see here. Jesus, my eyesight's getting terrible. Where screen 2, screen 1. There we go. Have you seen this one yet, Wally?
no, I pulled it up, but I saved it to watch it here.
Okay. One sec.
Go, Patty, work your own.
Let's just watch it the whole way through, and then we'll go back.
Reverse through a variable that comes up on top, looking to pass.
Ooh!
So he's going for an steamer lock right there. We saw what Calvin
Yes,
Casey did.
yes,
Wow.
yes.
Where is
Ow!
this?
Say again?
I wonder where this is.
I think this is in California.
So did he break something on the beat then?
Yeah, we'll go back because I saw 3 points, 3 particular points in this video where he did something that could have potentially broken his opponent's leg. The third one is actually where it broke, but the other two were just dangerous.
There is a break.
So this 15-year-old kid broke this adult's leg. I don't know if it was like, I'm not sure if it was his knee specifically or if it was one of the larger bones in his leg, but something did pop. Wally, did you catch the first dangerous point here?
No, it's gone kind of fast. So let's see.
Here, I'll play it and then I'll stop it
Okay.
so you can see what I'm talking about. And if you disagree with me, disagree. No harm, no foul.
Yeah.
But you know how this goes.
Go, Patty.
So right here they have, I think they're in 50-50, and the other guy has a figure 4 lock going with his legs. So this is standard 50-50, 50-50 play.
Work your own.
See how he's berimboloing to this side?
Mhm.
And you see how this guy's legs are locked like this?
Mhm.
The way that he's berimboloing and the way that his leg is trapped here, there's going to be a lot of pressure on his knee.
Yeah.
So
Yeah, he's got to release. Well, I guess,
right.
one of those things where it's you either release your leg or it's gonna get something bad's gonna happen.
Right. So that's dangerous in itself. But the crazy thing is when he completes it, and I'll continue. You see the force that he used?
It's like a weird angled knee bar
Right.
thing going on.
And if he had not let go, his something would have snapped, popped, or whatever in his knee.
Yeah.
Because that's a lot of force being exerted just by look at the way his knee pops out of it, or not his knee, but his leg.
Yeah,
it's very quick, but
because his thigh was over the kid's thigh was over the leg,
right.
So yeah, that's a lot of like pressure.
Yeah, that was one of the first things that made me that caught my attention. So just give me 1 second.
Yeah, that's nasty.
You see what I mean?
Yeah, because that's I can pop your ankle up. I mean, you don't do that standing up because like all his weight is pulling back on the ankle.
Right. And the worst thing is
he really doesn't have any way to kind of escape that.
Right. If he had not,
if you hadn't rolled, I mean, even this kind of roll that he's doing, it can put pressure on his neck.
Right.
So yeah, but I mean, that's like his only choice right now.
Right. Hold on 1 second. Hold on 1 moment. So, yeah. So it looks like he's doing an esteema lock. But most of the time when people do this, a yo does this standing, but he does it where
lower.
It's lower, and your body angle isn't the way that his opponent's is. So this is just a very dangerous angle to be doing this esteema lock in. And what makes it worse is the angle that this guy's body is in. When he drops down really quick like that,
Yeah.
that could break your shin. That could break your ankle. That's just a very dangerous game to play. Let's continue. So he gets out of it.
He's going for the steam a lot right there. We saw what Calvin
Yes,
did.
yes.
And then this is the point where his leg breaks.
Yeah.
So I
Yeah.
can't
It's
see.
like,
Go ahead.
I mean, I imagine his knee is pointing down, and the kid has the guy's leg, so it's like his um the opponent's knee is probably resting on the kid's like stomach or something. So it's basically like a like a belly down arm bar, but like with a leg.
Right. So can you hear the sound on this?
No.
Okay, good, because the snap is it's cringeworthy. But
Yes.
you see how he's just rolling? Like it's almost like it's either uncontrolled or deliberate. And there's you can see the guy's leg kind of at a weird angle, kind of in right here.
Yeah.
And then he rolls again, and that's when it breaks.
So he rolls back into doing the same thing again.
Right.
Yeah.
So, yeah, we'll stop it there.
Yeah.
But I don't know. What's your verdict? Do you think it's deliberate, or do you think he's just spazzy?
I mean, I don't think it's deliberate. I think it's one of those things where it's, you're in the moment and you're just kind of going with what you're going with whatever you're kind of like flowing with the situation. But I think that what he did was he was determined to get that, submission. So when it didn't work, you paused it at the point where he was, he had the guy's leg and hyperextended it. And then when the opponent got out and I think the kid just decided to roll back into it to try to get the submission again. So I don't think it was like spazzy. I don't think it was like deliberate per se, but it's one of those things where it's like, if you don't get a submission one way, then think about a different way to get a submission,
That's a good point.
What's your take?
I think if it was just like a one-off, like if this was the only video, I think it was like a mistake, But apparently there's multiple videos where he's kind of doing the same thing.
The same specific move, or
like just getting a submission and just ripping it.
Yeah.
So I'm as I think about it, I'm kind of 70-30. 70% leaning towards he's doing it deliberately. 30% towards he's just going for a submission and
But I mean, it's also one of those things when you're competing, it goes back to what's your sort of attitude going into these things. And for me, when I'm competing, my attitude is I don't want to hurt somebody else, right? So
right.
If, for example, I was in that position and you need to know what is going to possibly cause like serious injury to your opponent, and don't be an a-hole about it and just like go ahead into the position and rip it. You got to think about the other person.
Right. Yeah.
But then again, I'm not, I'm not a black belt at this stuff, and I'm not competing at that level. So it may be a whole other mentality, but I just think that it's, at the end of the day, there's a certain level of, you need a certain level of professionalism,
Yeah. Well, let me ask you this. Do you think a 15 or 16-year-old should be competing with a rule set that includes um, submissions that can be, as potentially as
Um, I
catastrophic
mean,
as.
yeah, I think the rules are there for kids and the rules are important. But I think if you have been training, from a really young age and you're training consistently
Hmm.
and you're progressing, that sort of thing. I think that sort of thing is fine. As a kid, I think it's fine for you to train or like to compete against adults.
Right.
And I mean, because yeah, the rules are there for kids because kids aren't really controlled, you know.
Hmm.
So, but I think if you're in the juniors division, whatever you want to call it, and you've been training for several years and you've been training consistently, yeah, I think it's fine to step up to the adult level. Now, I wouldn't necessarily put my kid in, you know, the adult level, even if they've been well, I wouldn't let them compete
Hmm.
at the adult level, even if they've been training for a really long time, because they're still kids at the end of the day.
Yeah. Uh, I don't know. I'm trying to think about why somebody would, because he's not giving people time to tap.
Yeah.
That's what's, I think that's what the bothersome thing is.
Hmm.
So I think that is probably why it looks like he's being deliberate.
Hmm.
There's a very fine line between applying a submission quickly and
Yeah.
not letting somebody tap, or and giving some not getting somebody a lot of time to tap, and then there's a very short distance to applying a submission with the intention of harming someone. And I think that's probably the question.
Yeah. I mean, do we know how long he's been training?
Apparently he's been training since he was little, so maybe
Mm,
10 years.
yeah. Because
Yeah.
I mean, I think at this point, it's not, you can't use the excuse of like, oh, I'm a kid, or like, oh, I didn't know that this was gonna happen, that sort of thing.
Right.
If you've been training for 10 years, you know what sort of damage can be caused from different, positions, right?
Mm-hmm.
So to that, yeah, yeah, it can look, I think you can say it may be a little bit of deliberate too.
Yeah.
Um, but I think also probably another reason why he is competing at the adult level is because he's like a big kid. So it's,
Yeah.
someone has convinced him that he can compete at this level, you know,
See.
just pretty much because of his size. Because you wouldn't see like a smaller kid competing against an adult, right?
Right. My concern is my concern is because he is 16, it
Mm,
that somebody out there might think that he is injuring people deliberately, and they
mm,
might injure him.
true.
And that could, depending on what the injury could be, that could be the deciding factor in how far he goes with his jiu-jitsu career. Because I
Yeah.
mean, I'll give him credit. Watching some of his matches, he is very good. He
Mm,
has a lot of potential. Um, but I hate to see that, go down the drain because
yeah.
somebody else has a vendetta against him.
I mean,
So
I think also it's, his reaction afterwards it didn't seem like he was all too concerned about what he did. You see folks who do stuff like this and either injure someone. Uh, Most of the times, if you injure someone by mistake, you go up to them afterwards and you check on them, that sort of thing.
right, yeah,
So I don't know. I don't know if he's trying to prove a point or if he feels like this is what he has to do to to compete at this level. So, or if it's like a coaching thing, it could also be that. I don't know. It's hard to sort of figure it out just based on these videos.
Right. Let's watch one more video. I gotta look. I gotta find it real quick. Hold on. Oh God, that scared me. Where is it? Oh, you know what? Never mind. Let's just go on to the doctor video.
Initially, everything's in.
Because I think that shows the match I was looking for anyways.
Mm.
All right, so this video is a doctor, the guy on the right. What was his name? I forget. He's going to review the match between the now 16-year-old and is this guy a 4th degree black belt?
Mm.
Something like that. I think his opponent's a 4th degree black belt, but let's see what he has to say about this match.
16-year-old phenom Pat Shigali absolutely obliterated.
Oh, wait a minute. You can't hear it, can you?
No.
Hold on.
His opponent's knee.
What? Where did that go? Huh. Ah, here it is.
In a split second at
Can you
the
hear it
recent
now?
Eddie Bravo Invitational, leading to a lot of appropriate discussion about the safety of something like this. Welcome back, everybody. I'm Dr. Brian Suter, and if you're new here on this channel, I talk about sports injuries and sort of the underlying anatomy and mechanisms. So if that kind of thing interests you,
I gotta
then
stop
please
it
be sure and like this
periodically.
video and subscribe for all future updates. I'm far from an expert on grappling and jiu-jitsu, and I certainly don't practice them myself, but I feel like I understand enough about it to know that you want to submit your opponent, not necessarily.
Ooh. Does he show that again? Because that's the point where we broke the guy's leg.
Yeah.
Part a move that is going to cause him to be injured.
Oh.
A heel hook like this done so quickly and so forcefully, to me, doesn't give the opponent a fair chance.
Oh, dude, that wasn't even a heel hook. Like, he didn't even... If he...
No, it's I don't know if it's modified, but it didn't look like one. It looked like I mean, we got it. I think we got to see it again.
Here, I'll just replay it. Because it looks like he just simply torqued the guy's knee.
Yeah.
Your opponent.
Yeah, that's not that. Yeah.
And subscribe for all future updates.
I mean,
I'm far from an expert on grappling and jiu-jitsu, and I certainly
looking at
don't
it again, it
practice
does
them
look
myself,
like a heel hook.
but I feel like I understand enough about it to know that you want to submit your opponent,
Yeah,
not
it's a heel hook.
Yeah, that's...
But it's just the force with which he did it was just, and that's what I was saying before, is he has enough experience to understand that like a heel hook and certain things, like an armbar, you can rip into an armbar, right? That's easier for someone to get out of, that sort of thing. It will probably cause less injury, but something like a heel hook, you can't just like rip it. You'll destroy someone's knee, like this video.
Right. Well, anyways, let's continue.
necessarily impart a move that is going to cause him to be injured.
I mean, it
A heel
already
hook
looked like
this done so quickly and so.
Yeah.
So
It already looked like it was facing the wrong way. It even looked like he tapped, though. If you go back a little bit, I don't know if that's a tap or
Want to submit your opponent,
right.
not
No, maybe,
I don't think he had a chance to tap.
yeah, he didn't have a chance.
necessarily impart a move that.
Oh man, look! Do you see that? His toes are pointing
Pointing downwards.
down.
Yeah.
And then he turned.
So like, play it again. Keep playing it.
is going
So
to
right
cause
there,
him to be
it
injured.
looked like he
A heel
tapped
hook
his
like this
arm
done so
right
quickly and
there.
so
Oh no,
forcefully to
no, it
me
just looks.
doesn't give the
I think his
opponent
arm was just.
Oh,
a
he
snapping.
was
chance
tapping.
to tap
He
and
did.
submit. But more on that
But it was
later
too
on.
late.
Let's first walk through the anatomy
Yeah.
and just what level of damage something like this can cause to somebody's knee. We have to start by understanding the rotational position of his competitor's left leg. Now, you'll see right here we get a clear view of the bottom of his foot, and so his left leg is a little bit frog-legged out to the side. The foot is a little bit in a neutral, maybe pointed externally position. As Shigali then sort of continues this move, we'll still see that the foot is neutral to a little bit forward, maybe externally rotated.
All right. You see the position his foot is in right there?
Yeah.
If he actually applied a heel hook properly, he wouldn't have to turn very much in order to get the tap.
Yeah.
Okay, I've up.
You at this point you don't really need to turn. You just extend backwards,
No,
and
you
then that should.
just turn slightly to the right, and you get you'd apply enough pressure to get the tap.
Yeah.
I've changed my mind about this, but we'll go over that after we watch the video.
But then as he goes into this heel hook, he continues to externally rotate the heel even more. So
Like
this
right
position
there, he could have
here,
stopped.
focus on the heel
Right.
right there. Notice that it swings up this way. That's going to externally rotate the heel, externally rotate the tibia or the shin bone, and so we have to think about what damage that's going to cause up at the knee. So here we go. We see that heel swing outward, the foot and the tibia continuing to externally rotate,
Yeah.
which obviously
Oh,
sets
his
up why this is so damaging.
face.
Say again?
I was just saying his face. He's like in so much pain.
Yeah. I feel
Now we
bad for
can
the guy.
see that his competitor's foot
Yeah.
is completely rotated 180 degrees. All right, this is not some subtle slight rotation. This is like almost a full 180 degrees rotation of the tibia, which is certainly beyond what it's supposed to do. We can see the toes pointing back, the heel is
But
up,
then
and
he
remember the knee
continues
is
to
still
rotate
facing
too.
Right.
upwards in this direction. It's a little deceiving here because it looks like the knee is maybe hyperextended, especially as he continues to kind of pull on it. We can see a little bit of the outline of the gastrocnemius muscle, and you almost get the sense that there's some hyperextension, but if you look at a different angle, you'll see that the knee was actually flexed. Now rotating to this angle, we can again see that sort of frog leg position of his competitor's left knee. Realize too, in this position alone, you'll tension the lateral collateral ligament that sits here on the outside of the knee. This is a common injury for wrestlers, and it's in this position where their knee is a little bit bent, gets forced into this varus load, and you pull on these lateral structures, potentially injuring your LCL. You can actually feel your LCL oftentimes if you sit in this figure 4 cross-leg position and sort of palpate on the outside of your knee. You'll feel a thin little cord. That's your LCL. So remember, the foot and the tibia are going to be externally rotated here. So initially, everything's in a nice neutral position. But as he kind of continues through the positioning here, you'll see how that...
Yeah. Yeah,
That's not good.
yeah.
Anyways.
foot and the tibia has now been completely externally rotated, and we're starting to catch a little bit of glimpse of something here that looks like a patellar dislocation or a dislocation of the kneecap. We can see as it continues through, now there's this clear kind of bony deformity step off where we see that outline of the kneecap because I suspect it's been dislocated. And again, we catch this full 180 degree rotation of the tibia where it's completely rotated backwards in that complete excessive external rotation. The foot should be pointing up this way. It's completely swung around in this direction.
Yeah, this guy's been around long enough to know
Yeah.
that this is gonna really mess someone's leg up.
Yeah.
Because the first match that we watched was when he was 15. This is when he's 16-ish.
Yeah, I mean, even if he's been, even in the 15-year-old one, he had been training long enough to sort of understand that. He should understand that there are certain moves and positions that are just going to absolutely destroy your opponent. And I just feel like the force with which he went into it, and like you mentioned, it didn't give his opponent a time to tap.
Mm-hmm.
That just feels deliberate, you know.
Yeah. All right, let's continue.
But you'll notice the knee is not hyperextended. It's in a little bit of flexion here,
It
which
looks like
also
he tapped
explains the
there.
subsequent damage.
Yeah.
His competitor then looks like he grabs the inside of the knee, and as we'll look at our anatomy model, that's going to be where the ligament that helps sort of anchor the kneecap sits. And so if you tear that ligament, you're going to have a lot of pain on the inside of your knee.
Ooh.
It's hard to even know where to start with the anatomy and possible injuries here, because something like this could completely obliterate and dislocate your knee. I mean, this is potential for a major, like life-altering injury. First of all, recognize that difference between extended and flex. So when the knee...
You know what? I wish my knees looked like that.
Yeah.
Because they sure don't. Mine are worn out. Anyways, let's go.
is straight or fully extended, there's this screw home mechanism of the knee that comes from the different contours of these bumps in the femur, where whenever you go to straighten your leg, that last little bit of straightening, your tibia or femur, depending on if it's closed or open chain, actually rotates. It rotates to sort of lock the knee into place. So that means whenever your knee is fully extended, it's essentially locked. You're not going to normally get any internal or external rotation of the shin bone when you're fully extended. But when you're flexed, meaning a little bit of bend in the knee, you do have a little bit of internal and external rotation play in the tibia relative to the shin bone. So because this left knee is flexed, that allows to apply that initial rotation in the external direction to further stress the ligaments. If the leg is completely straight, you're not going to be able to rotate the tibia to stress those ligaments. You're going to stress other things by hyperextending it, but you're not going to get the same type of rotation.
So is he saying, and forgive me, I'm a Neanderthal, if his opponent had a straight leg,
Yeah.
that this injury would have had a lesser chance of happening?
Yeah, so I think basically what he's saying is like your knee and your leg is like this. So if it's straight, then you're not gonna have that like rotation. But
Right.
because his knee was bent, there's more flex there, so there's more rotation. So
Gotcha.
yeah, he was saying if it was locked out, if it was straight, then you're not gonna get the rotation, but you're gonna get other sorts of like hyperextension.
Got it. Okay. So because the black belt's leg was bent, that helped.
Yeah, that kind of gave that allowed for more rotation at the knee.
Gotcha. Okay. So let's continue.
As you will when the knee is flexed. So the fact that it's flexed allows Shigali to initially start that rotation. The main restraints to external rotation of the tibia, and again, when we talk about external rotation, we mean going out this way, so spinning the tibia outwards, are going to be these structures primarily up on the posterolateral region of the knee. We call it the posterolateral corner. It's a very complex region of anatomy. Not everything is shown here on the model, but it's all these little ligaments and structures that help to stabilize a lot of the rotational stability of the tibia. One of the key structures is this oblique popliteal ligament that runs and is a little bit thicker on the back of the knee. But you can imagine how with this structure, if you take this portion of the tibia and you rotate it this way, you're just going to pull that oblique popliteal ligament. You're also going to stress this LCL and all this posterolateral corner. The PCL, which of course sits inside the knee and is sort of analogous to the ACL but in the opposite direction, is also important for resisting that external rotation. So you also run the risk of these cruciate ligament injuries when you have this severe of a forced external rotation. I mentioned how it looked like a patellar dislocation. So here we have our kneecap, patellar tendon, quadriceps tendon, and what's also on our anatomy but not shown on this model here is a little ligament that runs right here called the MPFL, the medial patellofemoral ligament. It's kind of the seatbelt that keeps the kneecap in place. What you're basically doing when you externally rotate someone's tibia is you're taking the insertion site, the tibial tuberosity, and you're swinging it out in this direction to basically pull that whole tendon bone complex in the direction that the patella typically wants to dislocate. Usually when the patella pops out, it goes lateral. So by rotating the tibia externally, you're just helping to basically push that kneecap out of place. Of course, that can lead to tearing of that MPF.
So hold on. The bone that was popping out of the guy's leg, that was his kneecap? Is that what he was saying? Oh,
Yeah, so
Lord.
he's saying like his kneecap, because of the rotational force, the kneecap popped out the side.
Oh. Okay. Let's go. 3 more minutes.
PFL ligament and significant pain on the medial aspect or inner aspect of the knee. So if we walk through all this one more time, remember the left knee is in a flexed position. The foot and subsequently the tibia are a little bit externally rotated here. As Shigali kind of continues to rotate and apply this heel hook, the foot and the tibia get externally rotated even more down here, as we can see with the heel swinging up, the toes coming down. And what that's going to start doing is applying tension to those posterolateral structures, the PCL. It's going to pull the tibial tuberosity, the insertion of the patellar tendon out laterally, making it more likely to sustain a patellar dislocation. And it all happens so quickly that I don't feel like there's really a fair chance for the opponent to tap and submit. And that's kind of the crux of what a lot of the discussion is on the internet about this whole sequence. Now, I'm not in any way an expert or understanding of all the rules and sort of ethics of the sport with grappling and jiu-jitsu, and I know there's a lot of controversy out there about this, and I think this injury in this video should highlight that the damage can be very, very real. I think we understand the severity of like head trauma with boxing, but these severe joint injuries can have just as much a long-term disability as something like a head injury. It's just going to be in a different way. And we see it. I mean, even the announcers on this broadcast were talking about how there's no time. It's basically, they said 0 to pre-op, implying that there's no chance really to process what's happening, tap, and then allow your opponent to stop applying the pressure. And that's personally my concern with this. You know, I know he's...
Yeah. I mean, he's spot on. You know, the guy who got his leg broken or knee dislocated, whatever, knee blown out, he's gonna have a while for recovery.
Yeah.
And
I mean, that's one. Yeah, go ahead.
And I don't know what this guy does for, you know, in terms of jiu-jitsu. Is he a head coach at a gym? Does he have MMA students? Like, is he this? If he does have a gym, is he the, you know, one of the main people who teach there? If that's the case, he's kind of
he's out.
Out for a while.
And I mean, just outside of what he does for work, outside of training and competing, he's never gonna walk right on that leg again. It's just one of those things.
Yeah.
It's one of those things where it's never gonna be the same again, which sucks. And then that can flow into confidence in competing, and it can cause a whole host of other things, and like other you could go into the kind of sports psychology of it.
Right. Yeah. And as somebody who has knees that hurt anyways, like my knees are in the best condition they've been in years, and I can still tell that my movement is limited. Like there's a lot of stuff in terms of strictly just judo, just talking about judo. There's a lot of entries I still can't do.
Yeah.
So yeah, poor guy. He's gonna have to figure out what his limits are now. But yeah, let's continue the video.
He's a young guy. I hope someone encourages him and kind of gives him the guidance that you don't need to apply that much pressure. I know it looks good. It sort of gives you this, nickname and sort of persona within the sport, but I don't think it's necessary. I think you can be just as skilled, and I'd argue show more skill by having the restraint to know when you've reached the limit and allow your opponent to have the chance to.
And that's what I said earlier.
That's I mean, this guy's. I think he's spot on. I completely agree with him. I think part of jiu-jitsu is also knowing when you have your opponent, right?
Mm-hmm.
And stopping at that point, or like at least kind of giving them the chance to tap at that point. Because I mean, he could have done the same thing but gone into it slower.
Right.
And I can almost say that, hey, maybe he did it this way because he wasn't confident in being able to hold down the black belt, because I think that, like I was saying, I think you can do the same thing. You can do a heel hook and still be controlled enough and still, hold on to the heel hook and rotate slower than he did. And I think that just goes to, I don't know. Again, I don't know if it's like that's just the way he's been trained, or if that's just kind of his mentality going into things. Is he's gonna go and destroy people's lives? I don't know. Yeah.
So here's an interesting little tidbit. Someone on Instagram messaged me saying that there was 50 grand on the line in that one particular match.
Mm,
So I don't know if
yeah.
that
That's yeah.
I don't know if that's true because I haven't looked into it.
Mhm.
But if that is true, that may lead down to the motive as to why he did that.
Yeah. But I mean, I don't know. Again, I don't do this professionally.
Right.
I'm not an MMA fighter, or yeah. But um my sort of
Hold on real quick.
Mhm.
If anybody in chat can verify that for me, that would be great. Sorry, continue.
Yeah, saying my sort of opinion is just like you don't want to be the person that causes somebody to have a lifelong injury. You
Right.
don't want to be that guy. Even if there's money on the line, you know, you don't want to be that guy.
Yeah. Yeah. I do this for fun. I do it to keep in shape. Um, I've been kind of slacking lately because reasons having to teach a little bit more since Master Sugi was on vacation. But the last thing that I want to do is injure somebody to the degree where they're gonna have a permanent physical
Yeah,
debilitate. What's the word I'm looking for?
debilitating injury.
Yes, I don't want to injure somebody to the degree where they even need surgery or even have to like step away from training for a while.
Yeah,
But you know, I have to be honest with you. I think he's being deliberate.
yeah.
Yeah, I was 70-30. Now I'm kind of like 95 ish.
Yeah.
So
And again, it goes, your attitude after something like that happens also matters.
right,
Like if he went up to the dude and was like, "Hey man, you okay?" Or like, "Hey man, I'm sorry about that," or whatever, or just like showed some love of concern, then I'll think, okay, maybe he's just not really, maybe he needs a bit more training.
right.
But, like if you do something like that and just walk off, then that to me kind of tells me that you did this on purpose.
Yeah, yeah, yeah. Yeah. I think I'm kind of done looking at this kid. To be honest, like I think I've seen enough. I don't really want to dig into his other matches and see like the same kind of thing. I think they'll start
Yeah.
like just screwing around with my head. But um, yeah, I think it's about that time. We got about close to an hour
Yeah.
of discussion, so I think it's a good stopping point, especially since Sunday. So,
Yeah.
final thoughts, Mr. Wole.
Don't be an a-hole. Don't cause anybody life changing, debilitating injuries. Train, yeah, train smart, compete smart, take it easy. It's not, well, for most of us, it's not our career. So don't go in there ripping people's limbs apart, that sort of thing.
Yeah, no, I agree. Um, and to add to that, I would say, as somebody who does teach, if this were one of my guys, I'd bench him.
Yeah.
I would. First time, I'll let it go. Second time, you're benched. Like,
Yeah.
I'm not. I can't do it. Like,
Yeah.
I can't be the guy that brings the destroyer to
Yeah.
the playground, so to speak. So, but
Yeah.
anyways,
It's also a small enough community where you get known to be that chin.
yeah, I wouldn't want to bring that to Master Sugi's doorstep or Big Brothers. So
Yeah.
yeah, all right. Well, Wale, thank you for joining us or
Yeah.
me.
Well,
Well, me and chat. So we will see everybody next week.
all right.
Oh, and
Bye.
come by September 1st, 7 p.m.
Yeah. I will put that on my calendar. Cool.
Okay. See you
All right.
later. Bye.
See ya.